Have you noticed subtle shifts in a loved one's behavior or health over the past year that leave you quietly concerned? Many believe the end of life in old age comes without warning, but the body often whispers clues months or even a year before that final moment. These signs are easy to overlook, dismissed as just part of growing older. Yet they hold profound meaning. Families often realize too late that these were signals, missing chances to prepare, connect, or make lasting memories. In this video, we will uncover 5 critical signs that may indicate an elderly person is nearing their final year. These insights can empower you to provide better care, cherish precious time, and ensure their final days are filled with love, comfort, and dignity. Stay with us to learn how to recognize these signs and make every moment count. Sign 1. Unexplained weight loss. One of the earliest and most revealing signs that an elderly person may be entering their final year is a noticeable drop in weight without any clear reason. You might see their clothes fitting more loosely, a belt needing an extra notch, or a once robust appetite fading away. At first, it is tempting to chalk it up to aging. But unexpected weight loss is often a red flag. It can signal that the body is struggling to process nutrients effectively, with muscles gradually wasting away as systems slow down. While aging naturally reduces muscle mass, rapid or persistent weight loss points to something deeper. The body may not be digesting food properly, or it might be unable to use proteins to maintain strength. This weakening does not just limit mobility. It heightens the risk of falls, compromises the immune system, and makes infections more likely. Another factor is a shift in appetite. Many elderly individuals lose interest in food as their sense of taste dulls, making meals less appealing. They might skip breakfast, nibble at dinner, or eat far smaller portions than before. This is not just pickiness. It is a biological shift where the body, sensing its decline, stops urging the brain to seek nourishment. The result is less energy, dwindling strength, and a slow fade in vitality. Chronic conditions like cancer, heart disease, or kidney problems can also drive weight loss, often starting long before other symptoms become obvious. Even emotional factors, such as depression or memory issues, can curb eating, creating a cycle where the body lacks the fuel to keep going. Families might try tempting their loved one with favorite dishes or boosting meals with protein shakes. But if the weight keeps slipping away, it is a sign the issue runs deeper than diet. Instead of pushing heavy meals, focus on small, comforting foods and keeping them hydrated to enhance their quality of life. If you notice an elderly loved one losing weight, eating less, or growing frail, do not brush it off. This is the body speaking, signaling a significant change. Recognizing this now allows you to act with care, plan thoughtfully, and make every moment with them as meaningful as possible. Sign 2. Overwhelming tiredness and frailty. A striking change that often emerges in an elderly person's final year is a profound, unshakable exhaustion that lingers no matter how much they rest. This is not just feeling worn out after a busy day. It is a deep fatigue that turns even simple tasks into daunting challenges. Getting dressed, walking to the kitchen, or chatting with family can feel like climbing a mountain. Routine activities that once brought joy, like gardening, reading, or sharing stories, may now seem too draining to attempt. This is not a normal part of aging. It signals the body is rationing its dwindling energy as vital systems begin to slow. The heart may not pump as strongly, reducing blood flow to muscles and leaving them starved of oxygen. This makes every movement harder and leaves the person feeling unsteady or weak. Metabolism also shifts, redirecting energy from activity to basic survival. which is why many start napping longer, sleeping more, or struggling to stay alert. You might notice them dozing off mid-conversation or needing to rest after minimal effort, as if their energy vanishes without warning. This fatigue carries an emotional weight too. Seniors who once thrived on independence may feel frustrated or ashamed when they can no longer keep up. They might pull back from social gatherings, avoid phone calls, or stop pursuing hobbies. Not out of disinterest, but because their body cannot sustain the effort. This withdrawal can spiral into isolation, hastening their decline as they disengage from the world. For loved ones, watching someone vibrant fade into exhaustion is heart-wrenching. It is easy to urge them to try harder or assume they just need a push. But this tiredness is not about willpower. Forcing activity can do more harm than good. Instead, honor their need for rest, create calm moments, and make their days as soothing as possible. Small gestures, like sharing a quiet story or sitting together in peace, matter more than pushing them to be active. If you see a loved one grappling with relentless fatigue, weakness, or withdrawal, take it seriously. It is a sign their body is shifting into a quieter phase. This is the time to surround them with love, ease their burdens, and ensure they feel valued, understood, and at peace in every moment you share. Sign 3: growing mental fog and emotional distance. As an elderly person nears their final year, you may notice a subtle but troubling shift in their mind and emotions. Someone who was once quick-witted and talkative might start forgetting small details, like where they parked the car, or struggle to keep up with a simple chat. They could seem lost in places they know well, repeat the same story, or mix up names of close family members. These are not just senior moments. They point to a deeper change. The brain, like any organ, needs steady oxygen and nutrients to work smoothly. But as the body slows, blood flow to the brain weakens, dimming mental clarity. This can lead to confusion, trouble making choices, or even brief moments where they seem sharp one minute and adrift the next. Alongside this, many withdraw emotionally. You might see them grow quiet, staring off during family dinners or skipping gatherings they once loved. It is not that they have stopped caring. Their brain struggles to process the energy of conversation or crowded rooms. Loud noises or busy settings can feel overwhelming, so they retreat into a quieter, inward world. Mood swings can also surface. Some may grow snappy or anxious over small things, while others seem oddly calm, almost detached from events that once sparked joy or concern. This is not a change in who they are. It is the brain adjusting to the body's gradual decline, making it harder to express or feel emotions as before. For families, this can feel like losing the person you know while they are still here. It is tempting to try pulling them back with questions or activities, but pushing can tire them more. Instead, meet them in their moment with patience. Speak softly, share familiar stories, or just sit together in calm silence. Even if they do not respond much, your presence can still bring comfort. If you notice a loved one growing more forgetful, confused, or distant, do not dismiss it as just aging. These are signs the mind and body are easing into a final phase. This is a time to create a safe, gentle space filled with love and reassurance, so they feel anchored and cared for. Even as words and connections fade, sign 4: repeated illnesses and sluggish recovery. As an elderly person approaches their final year, their body often struggles to fend off sickness, making frequent infections a telling sign. Someone who rarely caught a cold might now battle one bug after another, from stubborn coughs to urinary tract infections or skin irritations. These illnesses linger far longer than they used to, and even minor cuts or bruises seem to heal at a snail's pace. This is not just bad luck. It signals the immune system is weakening as the body's defenses wind down. With slower blood flow and declining organ function, the body cannot fight infections or repair tissues like it once did. Common ailments like pneumonia or gum infections crop up more often. And treatments that work quickly before, like antibiotics, may now seem less effective, requiring stronger doses or longer recovery times. For those less mobile, pressure sores or small wounds can become serious risks, reopening easily or leading to deeper infections if not watched closely. What is striking is how these infections might not show up as expected. Instead of a fever, an elderly person may just seem sleepier, more confused, or less interested in meals. With these subtle shifts often being the first clue something is wrong, chronic conditions, like heart or kidney issues, can also make the body less resilient, amplifying the impact of each illness. Families might feel frustrated, hoping one more doctor visit or prescription will turn things around. But when infections keep returning, it is a sign the body is losing its ability to bounce back. Pushing for aggressive treatments can sometimes cause more discomfort than relief. Instead, focus on gentle care, keeping their skin clean, ensuring they stay hydrated, and creating a calm environment to ease their body's burden. If you notice a loved one catching frequent illnesses, healing slowly, or showing sudden mental changes, take it as a cue. Their body is signaling a deeper shift. This is the time to prioritize their comfort, offer steady support, and surround them with care, ensuring their days feel as peaceful and secure as possible. Sign 5. Altered breathing and fading circulation. One of the most poignant signs that an elderly person may be in their final year is a noticeable change in how they breathe and how their body manages blood flow. You might observe their breaths becoming softer or more labored, with pauses that feel too long or patterns that shift unpredictably, speeding up then slowing down. Some experience a distinct rhythm, where deep, quick breaths give way to moments of stillness, a pattern known as Cheyne-Stokes breathing. These shifts may start subtly but grow more evident over time, signaling the body is conserving energy as vital systems ease. Circulation also weakens, leaving hands, feet, or even the tip of their nose feeling cool or looking pale. Sometimes, with a faint bluish tint around fingers or toes, this happens because the heart, pumping less forcefully, prioritizes blood flow to essential organs, reducing it to the body's edges. Even slight movements, like sitting up or speaking, can leave them breathless, and tasks like walking a few steps may now demand pauses to catch their breath. You might notice them breathing through their mouth more or needing to rest mid-sentence. In some cases, fluid in the lungs can add strain, causing a persistent cough, a gurgling sound, or a sense of chest tightness. This might make lying flat uncomfortable, leading them to prefer sitting upright or propped up with pillows to breathe easier. For loved ones, these changes can stir worry, tempting you to urge deeper breaths or seek urgent fixes. But often, this is the body's natural way of slowing down, and reversing it may not be possible. Instead, small comforts make a difference, keeping the room airy, using a humidifier, or offering sips of water to soothe dryness. In some cases, oxygen or medications can help, but the focus is on easing their experience, not forcing a cure. If you see changes in breathing, cold extremities, or rapalewi, it is a sign the body is shifting toward its final phase. This is a time to stay close, speak gently, and create a serene space where they feel safe, loved, and at peace. Knowing their presence still matters deeply, These subtle clues often emerge in the year before an elderly loved one nears their final days, whispering changes that are easy to miss but vital to notice. They may not all appear together, and some may seem minor at first, but together they paint a picture of a body gently preparing to rest. For many, these signs can be hard to face, stirring a natural urge to push back with more food, activity, or medical fixes. Yet, the greatest gift you can offer is to listen to what their body is saying. Instead of fighting the inevitable, you can embrace their remaining time with care, creating moments of warmth, laughter, and quiet connection. Recognizing these signs early lets you plan thoughtfully, make decisions with clarity, and ensure their final months are wrapped in comfort and dignity. This is not about dreading the end, but about honoring it, filling their days with love, shared stories, and the reassurance they are cherished. If you are walking this path with someone dear, you know you are not alone. Countless families have navigated this journey, and understanding these signs can bring you strength, patience, and peace. Thank you for joining us today. We would love to hear your thoughts. So please share one thing you learned in the comments below and how you might carry it forward. Your voice matters to us, and reading your words inspires us to keep going. If this video resonated with you, give it a like, subscribe, and share it with others who might find it helpful. Your support fuels our mission to create content that uplifts and informs. Thanks for watching, and we cannot wait to connect with you in our next video.